Welcome to the Introduction to CBT course. I'm so pleased that you decided to take this course. I'm Dr. Judith Beck. I'm the president of the Beck Institute for Cognitive Behavior Therapy in Philadelphia. And I'm also a clinical associate professor of psychology in the Department of Psychiatry at the University of Pennsylvania. This course is divided into 4 weeks. You can watch an entire week at one setting or in as many parts as you would like. You can come back to any week after you've finished one until a month after the course ends. Now, the goal of the course is to teach you certain commonalities in CBT. It's not to teach you how to treat any individual client. You'll learn about that in future courses. There are certain commonalities, though, that run across treatment for almost every patient, with the possible exception of clients who have schizophrenia, but we hope to have a course on that before too long, too. The way that I conduct therapy sessions and supervision sessions and teaching sessions are all the same. I tend to use the same kind of structure. So you'll notice that I already set a goal for the course, and next I'll be setting an agenda for the course. Again, something that I do in supervision and in therapy sessions as well. So here's the agenda for our 4 weeks. In the first week, I'm going to give you a broad overview of CBT. In the second week, we'll talk about cognitive conceptualization and treatment planning. In the third week, we'll talk about modifying people's distorted or unhelpful cognitions. That is, the thoughts that pop up into their minds and also their underlying beliefs. And then in the last week of the course, we'll talk about behavioral change and action plans. Action plans, which is what we used to call homework, are the self-help assignments that clients do between sessions, because this is what we found. The way that people get better is to make small changes in their thinking and their behavior every day. And that's why a lot of the therapy session is going to be oriented toward helping the client have a better week. Now, like a therapy session, our teaching sessions here will have a beginning, a middle, and an end. At the beginning of each week, we'll make a bridge from the previous week to the current one. We do this in a therapy session too. Then I'll set the agenda so you'll know what topics we're going to cover that week. Then I'll ask you some reflection questions. I'll probably say something like, what do you already know about this topic, and what do you want to learn about this topic? It's really important to think about these reflection questions because the more active you are as a learner, the more you're going to get from the course. At least that's what research shows us. In the middle of each week, I'll be presenting a topic, but there are a lot of ways that you're going to learn about this topic aside from just listening to me. One of the things that you'll do is you'll eavesdrop on a clinical roundtable that I have with our 3 therapists here at the Beck Institute. They're really terrific. Dr. Norman Cotterill.
We're giving people tools that they can use long after the sessions are over.
Dr. Francine Broder.
Part of the reason we set goals with our clients from the very first time we meet them is that in and of itself instills hope.
And Dr. Robert Hindman.
When you're able to really effectively work on your problems in the here and now, it gives clients that sense of hope, like, hey, this actually can be something that can help me. This can work.
Each week, we actually do meet in a clinical roundtable and discuss cases. For the purposes of this course, though, we'll be sitting around the table and we'll talk about the topics that I'm presenting that week. But there's a lot more that we're going to do, too. You're going to read some short course articles, you're going to watch some animation. You're also going to do practice exercises so that you can apply the techniques of CBT to yourself, to your own experiences. And you'll be answering reflection questions. So we have a number of ways in which you're really going to solidify your understanding of CBT. As I was developing this course, I had all kinds of automatic thoughts myself too. I was thinking, how can I get people who are taking this course to really get actively involved? And I thought, maybe the learners are going to have automatic thoughts themselves, especially about things such as posting to the forum. So I thought, okay, this is what I can do. I'm going to show video clips of a role-played session with Marisa Nunez. I'm going to pretend that Marisa is a young therapist named Sophia who is taking this course and has lots of automatic thoughts that are getting in the way of her active participation. So just in case you're having automatic thoughts similar to the ones that Sophia is having, you'll be able to answer them yourself and then be a much more active learner. At the end of each week, we'll wrap it all up. I'll be providing you with summary points for you to remember. And I'm going to encourage you to post one last time to the forum. Now you're going to post to the forum throughout the week. You're going to be asking questions, you're going to be answering reflection questions, you're going to be posting comments about the practice exercises, and at the end of the week, I'd like you to think about what you've learned during the week, post it to the forum. I'd also be happy for you to give me some feedback about your experiences during that week. You'll also see a section called Extend Your Learning. I'm going to encourage you to go to the course library. You're going to find wonderful resources there. And at the very end, we're going to make a bridge from the current session to the next one. This is also something that we do in a therapy session. It's really important that clients not see these therapy sessions in isolation, but that they see how one session builds on the one that came before. You'll also get much more out of the course and deepen your knowledge if you read Cognitive Behavior Therapy Basics and Beyond. You should have seen all of the automatic thoughts I had while I was writing that book. In fact, I may tune you into those a little bit later.